This Omicron variant has proved very, very infectious. We've seen millions of cases already, and it's only July.
Amid spiralling COVID infections, authorities are beefing up their advice. Masks still not mandated, but now strongly recommended.
Well, I think mask wearing in crowded indoor spaces is something we should see return. We've, as a community, and I include all of us and myself in this, have slacked off a bit.
The Victorian Government also recommending mask adherence, however rejecting a recommendation from the Chief Health Officer to mandate masks in school and retail settings.
I'm also obliged to consult with industry and community leaders and with my colleagues. We need to empower Victorians to make their own decisions.
No one ever wants to be told what to do. If we can give them the facts, give them the data, that's the way to go. It's no good giving them a stick. We need carrots.
Hospitalisations on the rise, already close to the January wave.
A particularly big increase in the levels of all kinds of circulating respiratory viruses, COVID, RSV, influenza. Children and adults are getting very sick.
As the hospital system buckles, expectations elective surgery may hit pause.
Every surgery is vital. We're really at the edge of a cliff. Combination of staff furloughing, being sick, the infective nature of all these variants, and then you throw in flu. Everything's come to a head.
With the more infectious BA4 and 5 subvariants now dominant, both New South Wales and Victoria have brought the reinfection period down from 12 weeks to just 4.
For 12 weeks, people have had this get-out-of-jail-free card for COVID. Unfortunately, what we're seeing with BA4 and BA5 has a lot more immune escape compared to previous strains.
So with a perfect storm of COVID, flu and other respiratory lurgies running red hot, are we doing enough to bring down the temperature?
Infectious diseases expert Paul Griffin, Professor Paul Griffin, is always a calm head in a storm, and he joins us now. Paul, I'm about to panic. Should I?
Look, no, we don't want people to panic. We want people to take this seriously enough to have a high enough perception of risk that they do the right things. We're really fortunate we've got expanded access to fourth doses, expanded access to antivirals, and of course we still have our masks and our social distancing and our ventilation, all of those tools. And if we put them together, we should be able to get on top of this wave fairly quickly. If we don't, this does certainly have the makings of something very significant. So we just want people to heed those warnings.
Well, the BA4 and BA5 variants are more infectious, but are they more deadly?
Look, they are really challenging, these new subvariants. We have seen some reports that maybe they do cause a bit more lung damage and maybe slightly more severe disease. They haven't been verified yet, so I wouldn't assume that's the case necessarily. The trouble for us right now is the numbers. The numbers are so high that even a small proportion of severe disease translates into big numbers in hospitals and enough people getting really sick, and that's certainly what we're seeing at the moment.
Well, on that note, experts are calling for people with any symptoms to stay away from babies because of RSV, and the flu is like wildfire. Is it time to think about mandating mask wearing?
Look, I don't think we need to mandate masks just yet. I think we need to do a bit more to educate people on the benefits. So many people, when we talk about masks, tell me they don't think they work, and that's not the case. They're not a perfect solution in themselves. Add that to a comprehensive strategy with all those other things that I mentioned, and they do help really well. And maybe we can look at helping facilitate mask wearing, maybe supply them at high-risk venues, for example. So I think we need to do more to encourage them, but I think a mandate's not necessarily the answer right now.
No, but it seems like, I know myself, unless it's mandated, I'm not really wearing a mask. So I'm part of the problem, not part of the solution, aren't I?
Yeah, that's right, and that's where we need to communicate that this is a very significant situation right now, and we can do something about it to alter the trajectory of this current wave, so people understand that what we're talking about now is a very significant wave of transmission. So certainly if you're going to a high-risk venue, somewhere crowded, poorly ventilated, for example, then I'd definitely be wearing my mask, at least for the next few weeks.
Professor Griffin, in what other ways would you say that Kate is part of the problem, not the solution?
Many ways. Let it rip, Professor.
Not nice.
Of course, the vaccines we have for COVID were all based on the Wuhan strain, which is long gone. And I was reading over the weekend that Omicron and COVID generally is evolving so fast that even if we were to come up with vaccines specifically for this strain, by the time they were widely available, it would have evolved again. And so it's just really hard to keep up. Is that a race we can ever win?
Look, I think we're edging closer and closer. We've had a lot of really good development in vaccines. It is likely we get an Omicron-specific booster in the coming months, and that will probably be one that combines the original strain as well, which will give us broader protection, so be a bit less likely to be outrun by new variants. And then there's a heap of work on so-called second-generation vaccines, even some that might be so-called pan-coronavirus vaccines, where changes in the virus will cause less in terms of reduced protection. So, we are getting better and better tools, and we're not suggesting that we're going to need to do this moving forward. Particularly getting a vaccine 4 times a year is probably not very practical, but we'll get better vaccines, and we're also going to get better antivirals, and we'll get better at managing this moving forward.
Paul, thank you very much for your calm head, your fantastic glasses, and your tie is fantastic tonight as well. I want to point out it's the full package, so we really appreciate all of that.
Oh, thank you. Thanks for having me.
The glasses of the pandemic, there's no doubt.
It's like talking to a wise ocean.
It is. It's exactly what it's like.
Did you notice, I noticed when we were overseas, no one spoke about COVID. It was really interesting. It wasn't that COVID wasn't there. I mean, you'd be on a packed tube, and we often wear masks because it was so weird being so close to people after all these years of being apart. And people were coughing and spluttering, and it wasn't like there was no sickness, but just no one spoke about it.
Yeah, totally.
I just found it really different.
In Europe, it's definitely like that. I was recently in America, same thing.
Why? Why do you think it is?
Well,
is
I think
it fatigue?
you know what I think the really big difference is they made, in both countries, they made a rule that you no longer had to isolate. So then there was no point if you got COVID or you didn't. Like if one of us gets COVID, that's 7 days, right? So you don't want to get it because you might have something important coming up, or you don't want to to travel or something like that. Or
but they don't have that.
They don't even
the
have
ramifications
that.
of it.
And so then it comes down to what's your experience of COVID, and everyone's either had it or knows someone who's had it.
So it's a tedious conversation.
And so I reckon that's probably what... Because
it was really different to the experience you have in Australia, where I feel like that's what all people talk about.
Yes.
Although, and people are still getting really sick.
Don't you think that... You actually probably were away when that started to change here.
Yeah, okay,
I reckon
right.
we just stopped talking about it until just now.
And you know what?
When I came back.
Yeah, that's right. But also it's a relief to stop talking about it.
Yeah.
Yeah.
That's right.